Click subscribe and bell icon to get regular notifications.
Hello everybody, this is Dr. Venugopal. I am the liver transplant surgeon and HPB surgeon from Yashoda Hospital, Secunderabad. Let us talk today something about liver transplantation. Liver transplantation means removal of either a part or whole of the liver and replacing with another liver which is necessary for the liver to function appropriately. Liver transplantation is required in two circumstances. When somebody is having a chronic liver disease and he has been under observation, and after evaluation he has been found to be meriting a transplantation which will benefit him. Sometimes it can be an acute liver failure where a transplant is needed very urgently within few hours to days to save his life. Now the causes for both of them can be any of the several causes. Normally for a chronic liver disease, the usual causes are alcohol, viral hepatitis like hepatitis B and hepatitis C, or sometimes what is more commonly prevalent now, the type of fatty liver disease or non-alcoholic steatohepatitis, which is commonly associated with obesity, diabetes, hypertension and hypercholesterolemia. Now this is increasing of late in the past few decades. In acute liver failure, sometimes the etiologies might be different. It can be metabolic, it can be a drug induced like overtake of certain drugs or intentional ingestion of certain toxins, poisons. Sometimes it can also be a vascular event, sometimes it can also be an uncertain event which still requires a treatment because the liver has failed. Now how do we know that the liver has failed? There are certain tests, normally the blood tests and scanning, which will let us know not only whether the liver has failed, and we also try to find out the cause of the liver failure. Once we have decided that the transplant is needed, then we need to think what are the options available. The options usually are either a deceased donor liver transplantation, which is otherwise commonly known as a cadaveric liver transplantation. Why I say deceased donor is appropriate? Because a cadaver means the life has completely stopped, whereas a deceased donor implies a brain death or sometimes a cardiac death. Now the other option is a living donor liver transplantation. Here somebody, a family member, which is necessitated by law in India, that they should be related to the recipient. Portion of the liver can be donated, leaving behind a sufficient portion for the donor to recover. Now this is known as a living donor transplantation. Now these two options, the results or outcomes of both of them are fairly comparable and acceptable. And with time, over the several decades, with the improvement of surgical techniques, perioperative care, anesthesia care and immunosuppressions, the results have been improving day by day. In deceased donor, the transplant happens usually at the transplant center, but we have to wait for the organ to become available, and this organ becomes available on the notification from the government. Now before that we have to apply or register ourselves for a cadaveric organ depending upon what organ we want, and this list is maintained by the government and it is usually given out by a protocol to the needed. So there is an element of waiting time, and it's especially difficult for people who are not from the transplant centers. Like you are from a different state, different area, you usually need to come and stay in close proximity to a transplant center to properly avail of this facility. Whereas a living donor, the donor undergoes examination and has to be fit before he can donate, and by Indian laws he has to be related to them. So once both of them are satisfied, then the surgery can happen. So it becomes a planned surgery or elective one. So we can do this surgery according to our own convenience at our own timing, when the recipient is in the best possible optimized condition. The results are comparable. Both of them have almost comparable results. About 85 to 90% survive for 1 year. There is about 60 to 70% survival for 5 years, and even 40 to 50% survive 10 years, 15 years, and there are still people who are living for more than 2 decades. What are the requirements apart from after a transplant? The patient who receives a transplant needs to be on certain drugs known as immunosuppressants, and he needs to take these medications lifelong. The doses of this need to be monitored after the transplant, the frequency of which is more in the initial few months, but after he reaches a stable state, the frequency will be about once or twice a year, with the understanding that any problem in the recipient, he has to notify the medical team. Now, he is a sort of lifelong surveillance. One is for the adequacy of the medications. Second, for the side effects of these medications, and also to properly dose these medications during his lifetime. And it is also to some degree assures, enhances that the patient is taking medications properly. There is no reason to stop medication once you feel well. If you stop these medications, your liver will get damaged and it is not easy to bring back the liver to normal condition again. So it's very essential that if a liver transplant succeeds, the patient will feel fine. But feeling fine is not a reason for him to discontinue these medications, unlike other operations. I wish all of you all the best and take care of yourselves.